Are you taking or considering taking a GLP-1 agonist medication like Ozempic or Wegovy, but have concerns because you heard about an increased risk of suicidality? Well, this is a very serious topic and a story that is ongoing and continually getting updated in the scientific literature. Now, a new study suggests that there is no increased risk, but there are significant limitations we need to be aware of. But first, the basics, right? GLP-1 medications are the hottest thing in medicine right now, with weight loss benefits unseen by any other medication, with sustained weight loss of 10 to 15% of body weight. Now, but notice I said unseen by any other medication. There's a little foreshadowing I'll expand upon later. But as with any medication, there are potential side effects, right? So anyone deciding on whether to take the medication needs to explore with their doctor the balance of the potential benefits and the potential risks. From the mild, low-grade nausea to the high percentage of lean muscle loss to the rare but more concerning stomach paralysis. And lately, more information about this concern of worsening psychiatric effects, including an increase in suicidal thoughts and attempts. We have explored the psychiatric concerns in some of our prior videos. And if you watch those, what you'll see is what makes this confusing is that some people in studies and experts report improved psychiatric outcomes with GLP-1s. And in a way, this makes sense, given the connection between poor metabolic health and increased prevalence of mental illness. So anything that improves metabolic health, like GLP-1s, should have a beneficial effect on mental health. But GLP-1s also have direct brain effects, so metabolic health effects, weight loss, and direct brain effects, because they're GLP-1 receptors in the brain, right? So perhaps that's why there's a variable response, but there's still much to learn about the mechanisms. Well, now a new meta-analysis of over 100,000 patients was published in JAMA Psychiatry, and it concludes that there's no increased risk of suicidality from GLP-1s. Now, importantly, this analysis includes both the oral GLP-1s used for diabetes and the injectables used for obesity. So from that standpoint, it's not a clean study looking only at Ozempic and Wegovy, so that may or may not be important. But perhaps the more important caveat is that all of these trials that were included in the meta-analysis excluded anyone with a diagnosis of depression or other serious mental illness or a history of suicidal thoughts. So that's crucial when interpreting this data. So based on this paper, for someone with no prior mental illness, there is little to no concern that these medications will cause new psychiatric symptoms or suicidality, which is obviously good news. But this tells us nothing about those with depression, with a history of suicide attempts, or with other serious mental illnesses. And that's a crucial caveat. So please understand, if you have a history of depression or other psychiatric diagnoses, the latest headlines likely don't apply to you. And that doesn't mean no one with a psychiatric diagnosis should ever take GLP-1s. That's not at all what I'm saying. But what I am saying is that it should be an informed discussion with one psychiatrist, and if someone chooses to start a GLP-1, they should monitor very closely for any worsening psychiatric symptoms, right? And we're bound to learn a lot more about this in the near future, especially now that these medications are being studied specifically for antipsychotic-induced weight gain. So that should tell us a lot. And look, these medications can be life-changing for so many who have struggled to find sustainable weight loss solutions. No question, they have changed lives. But that doesn't mean they're the only solution or even the best solution by themselves. I would maintain that if someone is taking GLP-1s, they really need to consider eating higher protein and doing resistance training to maintain their muscle mass, or at least prevent the muscle mass loss. And consider combining the medication with dietary interventions like ketogenic diets that have been shown to induce equivalent or even better weight loss with better maintenance of lean mass, and could help lower the dose or possibly completely transition off the medication, and even have been shown to show dramatic beneficial psychiatric effects. So while I acknowledge the beneficial weight loss effects of GLP-1s, I think we need to be careful promoting them as the one and only solution. So if you want to learn more about the mental health benefits of ketogenic therapy and ketogenic diets, please see our nonprofit's website at metabolicmind.org and our other videos here on our YouTube page. So thank you for watching. I'm Dr. Bret Scher, and we will see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.